Hey everybody, it is Thursday, July the 23rd, and it's been a couple of weeks since I posted an update on what's going on with our insurance claim. Um, so, Into the last video, I said I had who all I had filed with. I had filed with a grievance with a Farm Bureau. I had filed with the state of Tennessee. I had filed a federal uh, grievance. I don't think it's really a complaint. Maybe is a better term. Anyway, and I was just waiting on stuff. I had gotten a rejection back from Farm Bureau for my first level of grievance, which is I expected a rejection because in the first level it's me complaining to them about them, and they get to decide if they did the right thing or not. And I didn't have any faith in them doing anything from there. I knew I was going to have to go to at least the second level, so that's where I am now. But before going to the second level, I asked Farm Bureau for some specific information in print. It's the same stuff I'd been asking for all along. Exact dates, when they stopped paying for things, when things were excluded. I sent them a letter with a whole list of things I needed or wanted, asked them for. I got a letter back from them. I sent everything certified mail. I got it back in about 2 weeks, I guess. And they sent this entire packet. It was a giant envelope. All these papers right here. And I just got that yesterday. But along with that, because I filed this, actually 2 or 3 days later, I had filed with the state, and I got something from them. I got first a phone call, but I wasn't where I could answer the phone, so they sent an email and told me that they had gotten a response back from Farm Bureau. Farm Bureau responded to them a lot quicker than they responded to me, but that's neither here nor there. And what the state did was copy everything that Farm Bureau sent them in reference to their side, letters and information, and Miss Fuel has this and Miss Fuel has that, and this is why we're not covering this. And then they in turn copied all of that stuff and emailed it to me and said, here's their response. If you want to rebut their response, then send us documents, and gave me an email address. So I've spent today getting together information to rebut what they said, because of course it was topped with a letter. And when I first looked at the letter, the very first thing on there, there were like 4 false statements in the letter to start with. Like, what? It was like they said I had a $450 deductible, and I'd had this plan since I think they finally mentioned it on paper there for the first time that this plan has been in effect since 1999. But then from 1999 they skip all the way to 2010, and they say I have a $450 deductible. I've never had a $450 deductible. One thing. So that was the first red flag. And then I read on down, and it gives some other things, some dates and some times, and just some things that I think are weird. So I got out my big book, this big book over here. I got out this big book, and I started pulling things out, and I rebutted everything they said in there. Let me see if I can get my hand on that letter. And sent it back to the state. Okay, here it is. So the state sent their rebuttal letter, and then they sent this piece of paper that had like 4 exhibits of proof why they should not have to pay for this. And anyway, I went through all of that, and there was just some false information on there. First, I've never had a $450 deductible. It says on here again that routine, it says that a cochlear implant is not covered, but not only is cochlear implant not covered, anything associated with it is not covered. No kind of screening, exams, hearing aids, any medical service that has to do with a cochlear implant would be excluded under their plan. That's a giant red flag, because I have 8 just from this year alone. They've always paid for anything that had to do with hearing, exams, audiologists, MRIs, anything, ENTs, any kind of testing that they did, they've always covered it. And I didn't want to go all the way back, though I'm sure I can, and pull out some EOBs from time past. And if I have to, I will. But I thought I'll just start with now. And I went into, just to save myself some trouble and digging through that big box of papers, I went online to their portal and pulled up the EOBs. I pulled up the most recent EOBs, the last, actually everything he has this year that is related to this, leading up to needing a cochlear implant, starting in February. And every single one of those things that he says in his letter is not covered, they covered. And they covered, just with our $40 copay, they paid the rest at 100%. They paid for multiple ENT visits, multiple audiologist screenings, an MRI. They paid for a consultation and a surgical workup with Dr. Tofik at Vanderbilt. Everything that had to do with that. So all of the audiology testing and everything except the MRI, which we took with us to Vanderbilt, was repeated at Vanderbilt. They did their own audiology testing, and more extensive, a lot more extensive than they had done at Jackson Clinic. It was all paid for. They paid for every bit of it. Doesn't say non-covered anywhere. They paid for it. It went through where they did their usual UCR cuts, and they paid 100% of a lot of the stuff for office visits after that. So, most insurance companies declare things are not covered, but then pay the claims on them? It doesn't make sense. They played the claims all the way up until the doctor asked for a pre-certification for the cochlear implant surgery, because they had determined through all of their testing that that was the only course of action for us. The only thing that was going to restore some hearing in that deaf ear and keep him from being totally deaf. So there's that. I mean, they say in the letter it's not covered and nothing about it's covered, yet they contradict themselves with covering. So that's that. I've got 8 recent examples with that. I'm sure I have 50 more if I want to dig back through the years, but these 2026 ones totally knock that out in my eyes. It either it is or it isn't, and this proves right here it is, because you don't pay for stuff that's not covered. Which makes me think they're still operating under my original plan somehow. It always was covered. Now they're going to decide it's not. But anyway, so I took that information, made photocopies of all of that. I made and called out the things in that letter that were wrong. My deductible, and the fact that they're saying it's not covered, it's never been covered, we've never paid for anything about it. All of that is false. And I sent all of that back to the state. And then, so I'm okay, I'm good. I've sent them what I need to send them as a rebuttal to their letter to the state. So I pulled out this packet of information that I got yesterday, this big, thick that I just showed you. This is not even half of it. Yesterday, and started at the top. It started with a letter, and it was in reference to my asking for information so I can do my second level grievance. And so it's like, this is what you asked for, and this is what we're sending, even though it was worded different. And I don't think I'm not sure that they sent me exactly what I asked for, but they did send me some stuff. And then in my research, I was reading something that says, this is a common practice. It is a document dump, and they count on the consumer not going through and looking at all that stuff, just saying to the heck with it and throw it in the garbage can and moving on. But I'm not doing that. I am going to see this all the way through. So I start flipping pages, and I didn't get but about 5 pages in, and I find a form, a change form. And I recognize this because I've seen one before. I signed one in 2021. I don't know, I can't remember exactly what time of year was it. I'm thinking it was probably January 2021, or it might have been December 2020 to be effect January 2021. But anyway, end of one year or earlier the next, I signed a change form to change my deductible from $300, which is what it had been since 1999, to $2,500, because I think I went through before. I decided that was cost effective. The money I was going to save in premium would help me pay for my deductible if I had to meet it. So that's the one time I've signed one of these change forms. But I look and I'm like, oh, there's a change form, and this change form doesn't have a date on it at all. It's just stuck in there. It's stuck in there, and actually there's more than one. There's 9. There's 9 of them. Every single time that they changed my deductible without my consent, they just said, we're changing your deductible. They filled out one of these change forms, and they put my name on it. Most of the time they put my birthday. They didn't always put my birthday, but they put my policy number right there. And if you look at this, down here at the bottom, it says, I have reviewed the table on the back of this form. Understand that I'm changing my plan to one with a higher deductible and out-of-pocket maximum cost. I understand that to regain benefits or lower deductibles, reapplication with medical underwriting for approval and pre-existing condition periods and waiting periods will apply, which is what they forced me into when they changed me to an $8,000 deductible and reduced my benefit to 70%. They said, in order to go with another plan, we'll let you move to this. We'll let you move. We're going to move you to this one. If you want to move to something else, you need to go back through underwriting, and we're going to hold all of your medical, anything that's in your medical records against you. So they would exclude anything I go to the doctor for. And that's not how this is going to work for me. But anyway, back to this form. So there are 9 of them in here, and every time they changed my deductible, they raised my deductible, they put one of these forms in there. Okay, but down here it's saying what the coverage is changing to, which I didn't pick. And then if you move on down here, it says, I have reviewed and I'm signing this, blah, blah, blah. Subscriber signature. Notice that is blank. And it says date, blank. In other words, I was saying all along, I didn't make any of these changes that my plan has. You made them without my consent. This just proves it. 9 times they put a form in there with no signature. And this is what I thought was really funny. Underneath the bottom of the fine print, it says, it's a crime to knowingly provide false, incomplete, or misleading information for the purpose of defrauding the company. What about defrauding the subscriber? According to what I've read, Farm Bureau is exempt from a lot of things. Even though, because they're not really an insurance company, but they are. I have another piece of paper where they're declaring themselves an insurance company. So that's a whole nother ball of wax. It's like every time I start working on one thing that I think is wrong, I find 12 more. They say they're a subscriber group, and not really act like an insurance company, but when they declared themselves grandfathered, then they became a licensed insurance company that has to go by some regulations. There's some there. It's not a free for all. They have some things they have to abide by in order to fall within that. And I'd already established that, well, they weren't doing that. And they weren't abiding by the things if they had to be ACA compliant. And everybody knows they're not ACA compliant. So they're not doing that either. It's like they want to be on both sides of the fence and the top all at once. And then if when you call them out, then they're just going to take down the fence and go somewhere else. But anyway, I think, I know they're an insurance company. I have a piece of paper that says they're an insurance company. I have papers from them declaring themselves an insurance company. So that's one issue I've got. But with the state legislature in Tennessee is known for, they just work for corporations and big business. People and citizens of the state are their last, they don't care. They're working for whoever is putting the most money in their pocket, and that is big corporations and insurance companies and groups like Farm Bureau. I mean, Farm Bureau is heavily lobby the state government to get them to do stuff, and this is one of them, I'm sure. So there's this carve out that says basically Farm Bureau can do whatever they want to do, but within that, anything they want to do, they have to go by what I've read, basic contract law. And basic contract law says if you change a binding contract, and my original policy that I signed back in 1999 is a binding contract. And if any changes are made to that after the fact, they have to be signed and dated. Okay, lots of changes were made, but there are no signs and dates. There's a piece of paper with a blank signature line and a blank date, and we're changing this without your consent. So it looks like to me that's a violation of contract law if it were to fall within the we're not an insurance company carve out, which they don't fit either, because they say they're grandfathered and they say they're an insurance company. So there's lots of different issues going on right now with me and Farm Bureau. When I discovered this is after I had emailed my rebuttal to the state. When I discovered this, I made the copy of the top one of these and attached it with a letter of assumption. This is their letter of assumption that was in that stack of papers they sent me. I read somewhere when they do a document dump like that, if you will take the time and look through there, they usually inadvertently include stuff that will help the person, me. And they did. I think. Here's this assumption certificate, and they had already sent a copy of this to the state, so I had already seen that this morning. But it says in there, let me find it. The benefits, premiums, and other terms of your coverage are unchanged by the assumption. And that is when the assumption is when they became an insurance company. And I'm assuming this is when they went from Blue Cross to UMR. I think that's the same time, March 2010. And notice, TRH Health Insurance Company. It's got their address. If you are not an insurance company and you are putting that on your letters and you are proclaiming yourself to be, that's false advertising. So which is it? I just keep finding contradictions in everything I look at. So I sent the assumption letter and a copy of one of those blank forms to the state to be attached to my rebuttal that I had already sent in. And I just said, basically, I went through this trove of documents they sent me, and I found this after I'd sent that. Please attach this to that. And then I waited a couple of hours, and I called and talked to somebody up there and made sure they had it, and they looked it up on their email. Yes, we have it. Both things, and he said to me, I will send this over to Farm Bureau, and they've got basically 10 days, but you have to allow for weekends, which we're coming up on a weekend, so 12 days for them to make a response to the state. And they do respond to the state a whole lot quicker than they respond to me or you, I'm sure. So that's where we are with that. Now, I have the information I asked for the second level of grievance, which is an independent panel outside of Farm Bureau. So this time it's not supposed to be Farm Bureau deciding whether they are doing wrong. It's an outside panel deciding if they're doing wrong. All the while I've got Tennessee Department of, I think it's Commerce and Insurance, looking at if they are complying with laws and rules that they're supposed to be complying with. So that's where I am. I'm going to take probably tomorrow afternoon and get together my second round grievance and go ahead and send that into Farm Bureau while I'm waiting on this. I have not heard anything from the federal government. The complaint, the place where you can make a complaint about insurance to the federal government starts with an email, and it's been a couple of weeks now, and I'm going to look back and I'm going to follow up and resend that email because I haven't heard anything from the federal government. But I will hand it to the state of Tennessee. They were Johnny on the spot. They came back immediately with, we got your email, and if you need to send us anything else, they gave me all the information and a email that I could send documents to, and I did that, and every time I'd send them something, they would let me know they got it and what they have, and what clock is ticking now, how much time we got to give whoever. From the original rejection of the first grievance, it said I had 90 days to file a second grievance, and I've probably used up maybe close to 3 weeks of that. I don't know exactly off the top of my head, but so I've still got plenty of time on that. But I'm going to get on it. I am not waiting 90 days. I want everything firing at once. It's either all going to blow up at once and be over, or I'm going to get some resolution quickly. I'm not waiting. I'm moving ahead. So that's what I'm doing. Again, if anybody has any idea about any of this, about contract law, about the fact that Farm Bureau can do what they want, how they want, which is a huge red flag to me. I mean, had I known that, I probably would have left a long time ago, but it had been good up until then. But knowing now that what I was told by someone in this loop was that you had a good plan, and you've had it for all of these years since 1999, and it was good. And I interjected. I got it when I was in my 20s. I didn't have any health issues. Well, now I'm 60, and I don't have anything major, but I go to the doctor every now and then, and so does my husband. And now that I'm of an age where I might have some health issues, it looks like they're trying to ease me out the door. They're trying to get rid of me. And when they did what they did and jacked my deductible way up to $8,000, that just let me know that that's what they were trying to do. And in order to keep decent coverage like I had, I've got to go back through underwriting. So I don't think it's right that Tennessee allows an insurance company or somebody pretending to be an insurance company to do that. That ought to be illegal. And the state legislatures made this carve out for Tennessee Farm Bureau, but they're still not following the rules. So anyway, we're going to see where this goes. I'm going to be the squeaky wheel. I am going to bother them and call them out on everything I find. This started with one issue with them not covering one service, and I have found 20 issues of things they have done that are not on the level to me. Not exactly on the level, and I just don't think it's good. If you have Farm Bureau insurance and you are 60 years old, or have some, or maybe of age where you might develop some health insurance issues, you need to go ahead and get an ACA plan. Grandfathered basically means they can do what they want to, which is not much. The ACA plans have to pay for medically necessary stuff, as they should. So after I get a resolution with this, that's probably where I'm going to head, but I've been paying this premium too long. I just feel like they owe me, and I'm going to push this until I get some kind of resolution. I will update as soon as I know. I guess the state will be the next thing I'll hear back from, because they're really quick. I'm filing again my second level grievance tomorrow. I may come on and say what I put in that as I get that together. But anyway, I just wanted everybody to know where I was, and I will keep you updated. And everybody have a great day. And don't forget to reach out if you know somebody. If you know something, if you know anybody that has had something similar, let me know what they did, how they handled it, because I cannot be the only person having this problem, or having had this problem, that is not just giving up. So, have a great day, and see you next time.